Hey everyone. So this video is just going to be about the bony landmarks of the cranium. I made a separate video for the bony landmarks of the face, including the eye socket, nasal cavity, oral cavity. Just because there's so many bony landmarks in the skull, I really didn't want to make a 20-minute video. That's very overwhelming. It's too much information. So to start, you just need to know the sutures. So separating the frontal bone from the parietal bones is the coronal suture. Separating the parietal bones, you have the sagittal suture. Then separating the temporal from the parietal bones is the squamous suture. And then you have the lambdoid suture. Now it's called the lambdoid suture because this is the capital Greek letter lambda. And whenever you see oid, it means it looks like or it's similar to. So they're saying it looks like the Greek letter lambda. So inside the skull, it's broken up into three big sections. You have in the front the anterior cranial fossa, the middle cranial fossa, and then in the back is the posterior cranial fossa. The word fossa means like a bowl or a basin, so it's just talking about the three little bowls on the inside of your skull. So the temporal bone on the side of your head, there's the mandibular condyle, which is part of the mandible, but the mandibular condyle sits inside of the mandibular fossa to make up the temporomandibular joint. You also have the zygomatic process, which is a little arm of bone that's going towards the zygomatic bone. If you look, there's a little suture here which separates the temporal bone from the zygomatic bone. But then the whole arch, which is partly zygomatic bone and partly zygomatic process, is the zygomatic arch. Your ear hole is the external acoustic meatus. Those little bumps you can feel behind your ear are your mastoid process. And then you also have the styloid process, which is like a little point. Like a stylus is a pen. So the styloid process looks like a little pen. So it's not quite clear in this picture. You can see the styloid process, the mastoid process, and if you were looking straight down, you could see in between the two there's a little hole called the stylomastoid foramen. Coming to the inside of the skull, here's the borders of the temporal bone. You can see, especially on the top, there's little sutures which separate it from the sphenoid bone. The ridge of bone here, which I call the mountain, is the petrous region of the temporal bone. And you also have some holes in the temporal bone. You have the foramen lacerum. Think like a laceration is a cut. This hole kind of looks like a gash, a deep cut. And the carotid canal, which is in the same channel as the foramen lacerum, but is a separate hole. And on the side, you can kind of see a little indent, which is the internal acoustic meatus. And if you drilled straight through from the external acoustic meatus, you would end up inside the internal acoustic meatus. Although in the skull, it's just a little divot. It's not a full hole through. Coming to the occipital bone on the back of your head, you have the occipital condyles, which are two little bumps. Remember that condyle means a bump that fits into a joint. So the occipital condyles form the joint with your first cervical vertebrae. And running through the occipital condyles is the hypoglossal canal. It's called that because the hypoglossal nerve runs through it. You don't need to know that now. You'll learn it when you get to the brain, but just so you know, it's not a random name to torture you. It's named after a nerve. The bump on the back of your head is the external occipital protuberance. All right, so inside the skull, most people know the big hole that your spinal cord is exiting is the foramen magnum. And then you have another quite large hole, the jugular foramen. You need a big hole for a big vein. So the anterior cranial fossa is mostly frontal bone, but kind of wedged inside the frontal bone is the ethmoid bone. It's just a little bone. And the ethmoid bone has the crista galli, which is a little point. And the top of the ethmoid bone, those plates are called the cribriform plates. And inside the cribriform plates, you have the cribriform foramina, which are just those little dots you're seeing. Behind the ethmoid bone and the frontal bone is the sphenoid bone. And the sphenoid bone has greater wings and lesser wings. Also, if you look towards the center, you see there's two little ridges of bone with a dent in the center. So the whole thing is called the Sella Turcica, which means Turkish saddle. And part of the Sella Turcica is the hypophyseal fossa. So if the Sella Turcica is like a little seat, the hypophyseal fossa, it's the bowl part. And it's called the hypophyseal fossa because the pituitary gland sits inside of it, and another name for the pituitary gland is the hypophysis. So the sphenoid bone also has some foramen, the optic canal, which exits into your eye socket. Also, you have the foramen rotundum, foramen ovale, and foramen spinosum, ROS. Now, what you're seeing here is a dissected sphenoid bone. It's just a sphenoid bone separated from the skull. This part in the center is, you know, a slice through the skull. And coming down, you see there's like two little feet. Those feet are called the pterygoid processes. Just this whole region here are your pterygoid processes. And you can also see your pterygoid processes if you look underneath the skull, behind the roof of the mouth. The little things coming down on the either side of your nasal cavity are the pterygoid processes of the sphenoid bone. All right, so that's it. That's all the bony landmarks of the cranium, at least those that you would need to know for an introductory anatomy course. I know it seems so overwhelming. But like I've said before, break it down into manageable chunks. Learn 7 to 10 terms really well, then move on to the next set of terms. And before you know it, you'll be through the whole thing. Well, I hope that was helpful. Thanks for watching and good luck studying.